But first, Erlanger has opened a new lactation center. And joining us right now, we have Cindy Nash, who's a registered nurse, who's also a registered lactation consultant with Erlanger Health System. And we're talking about a new breastfeeding clinic that has opened up at Erlanger. And I guess maybe there might be several that are out there thinking you may go and talk to your local doctor or if there's anything, any sort of concerns. But this is a whole clinic sort of dedicated to, I guess, breastfeeding. Why was that a necessity?
Well, Erlanger is really good about helping moms with breastfeeding when they're in the hospital, when they've delivered their baby, and we really pride ourselves in that. And once a mom goes home, believe it or not, that's when most moms want to quit, when they lose kind of their support system. So we see a lot of moms kind of drop off breastfeeding within the first couple of weeks of going home from the hospital. So we determined that's a real need in our community to have a place for them to be able to follow up where they can actually have their insurance billed. And so they get to come back to the clinic, get some help. We bill their insurance, which is really good for the wallet.
Now, lots of times, we think, well, we go back to the hospital, something is wrong. But in this particular case, I mean, who qualifies for this? Is it someone that needs help, or is it just someone that needs updates? I mean...
Yeah, so any mom is welcome to come and use the breastfeeding clinic. Any mom that feels like she needs a little extra help, maybe an extra set of eyes looking in on her and her baby as she's feeding the baby. Some moms come back because they really feel like they really are struggling. The baby's slow to gain weight, or mom's having a lot of pain with breastfeeding or some specific problems like that. So she'll come to the clinic and get some help.
With all the different types of formulas and everything that's out there on the market, why do you guys advocate breastfeeding so much?
Oh, breastfeeding is hands down the healthiest thing for a new baby, and for mom's health as well. There's so many reasons. I would take a whole hour show to talk about the benefits of breastfeeding.
I can understand that. And of course, when it comes to our babies, they want to eat just about any particular time during the day. But you guys have sort of set hours, though. When are you guys open?
We're open right now on Tuesdays and Thursdays from 8:30 in the morning until 4:30 in the afternoon. And we are open at Children's Hospital in the Massoud building, which is really convenient for moms. Believe it or not, we've got valet parking right outside of our Massoud building entrance, and so it's really simple for her to get there. The clinic is really easy to find. We do plan to expand hours and location to include Erlanger East campus as well.
Now, when it comes to, you touched on this a little bit here, you have sort of that support group when you are having your child and a couple days thereafter. But this is not just a support group, though, too, because you can come in. There is that part, that aspect of it, but there's more to it than just that.
Erlanger does have a breastfeeding support group for moms that meets at the Erlanger East campus. But this is a one-on-one private lactation consult with a board-certified lactation consultant, we take moms who either kind of find out about the clinic and refer themselves, or we do have a lot of local pediatricians and OB doctors that will call us up or send us a fax referral request for them, their patients to be seen.
Now, we might have some new moms that are listening now. When it comes to breastfeeding, sometimes we may not think we need the support, we know what we're doing, but there's that possibility where something's not going right, or there might be a sign of something. Are there some maybe tips or some signs out there that we can tell the moms that say, hey, if you are seeing this, it might be a great idea to stop by? Yeah,
definitely. If she's worried about her baby's weight gain, especially in the first couple of weeks, if she's having continued pain with breastfeeding, if she feels like she's feeding her baby constantly and there's never a break, maybe there's some reasons that her gut feeling tells her something's not right. She should stop in, even if she thinks, I think I'm doing okay with this, but I just want somebody to just kind of reassure me. We're really good cheerleaders too at our clinic.
Now, there might be a case where formula has been the go-to here for the early on, but want to switch to breastfeeding and still kind of come in for that education?
Oh, definitely. We've got a lot of moms who've had to use some formula, and then, they're ready to try to go just back to exclusive breastfeeding, and we definitely work with them. A typical visit includes, we start out by we weigh the baby, and then mom feeds the baby, and then we weigh the baby again to see, how much milk has transferred to the baby. We leave the visit with plenty of time for answer questions from mom, and then we give her a real detailed plan for how she should go forward. And I do want to include too that we have a really good cohesive working relationship with the area pediatricians.
Okay.
We give them a summary of every baby that we see and always tell the mom, you know, go back to your pediatrician for any needs. If we have a baby that we feel like we have a need right away, we'll call the pediatrician.
All right, folks, it is the breastfeeding clinic that's now open at Erlanger Health System. Again, Tuesdays and Thursdays from 8:30 a.m. until 4:30 p.m. For more information and location, feel free to give them a call, 423-778-4182. Again, 778-4182. You can always call Erlanger for anything that you need. Their phone number there, it is 423, I think it's 778-LINK.
4181.
For what?
778-4181 is for the clinic.
Okay, all right. We'll fix that on our website, newschannel9.com. We appreciate you coming in and helping us out today.
Thank you.
All right, folks, come experience the 4